for some time now there's been an interest in patients and their collective dose of radiation over a period of time. But a few years ago, actually, at an ESC meeting, we talked about the fact that doctors and other operators, they also have a tremendous amount of exposure on the long term. And so ever since then, there's been a variety of ways to try and lower radiation dosage. A great paper coming out in JACC Imaging, and it is the August issue, and we are here to talk to Dr. Simon Deseive, who is at the University of Munich in Germany. This is a prospective randomized trial on radiation dose estimates of CTA, and you're applying iterative image reconstruction, and this is Protection 5. First off, tell me about Protection 5 and why you did the study.
Well, actually, I would like to start with a little talk about coronary CTA, because we all know that coronary CTA has a lot of strength, especially in ruling out effectively coronary artery disease, and thus for predicting future cardiovascular events. But this advantage comes at the downside of using radiation dose. And this has always to be weighed against the possible benefits of the technique. And I think it's best described with the ELERA principle, which I would like to quote in this context. It basically says that radiation dose should always be as low as reasonable achievable. And it tells you that you should always try to lower the radiation dose, but you still need to maintain diagnostic image quality, because when you lower the radiation dose and your image is of insufficient image quality, you won't have a benefit for the patient as well. And that's basically what makes the protection serious, because we always use the diagnostic image quality as the primary endpoint and the radiation dose as the secondary endpoint. So we always want to maintain diagnostic image quality and see how we can achieve this goal while lowering the radiation dose on the other side. And in Protection 5, we wanted to investigate iterative image reconstruction. All four major CT vendors came up with different techniques for iterative image reconstruction, and we wanted to see if we can have like generalizable results for all those four major CT vendors, and this is why we included all four vendors in the study and wanted to see if we can lower radiation dose while we maintain diagnostic image quality.
Now we should note the fact that there have been single center validation of IR in the past, but what you have here is a large-scale multi-center randomized trial. And so that's why this really stood out when I started looking at the papers. Can you talk about the study design and the endpoints?
Yes, actually, as I mentioned before, the primary endpoint was diagnostic image quality. We did it with a non-inferiority analysis, so we assumed that a reduced tube current reduction actually of 30% with the combination of iterative image reconstruction would allow for maintenance of image quality. And so this was our primary endpoint, a non-inferior diagnostic image quality. And the secondary endpoint, or one of the secondary endpoints, actually was radiation dose. And because we lowered the tube current with a fixed value of 30%, it was no surprise that the overall radiation dose in the end was 30% lower, because it's a linear linkage between those two. And we indeed could maintain the diagnostic image quality. So we were able to prove that the use of iterative image reconstruction in combination with a 30% lower tube current is actually able to maintain diagnostic image quality. So we achieved our goal to validate the usefulness of iterative image reconstruction.
And you did it across all four of the different imaging units available, and they all seem to work pretty much the same.
Yes. Actually, we powered the study for the overall, for all patients and not for the subgroups. But we observed comparable radiation dose reductions and comparable image quality scores for all four major CT vendors. So I would assume that it works in all vendors. So
now, what's next? I mean, what do you want to do now that you know this? will you be trying to lower the radiation dose even further, or what?
Well, I think our study should be considered as a proof of concept study, proving that the concept of iterative image reconstruction is feasible and is useful in coronary CTA. I think what should come up next should be to do dedicated studies to see to what threshold you can lower tube current or maybe even tube voltage to further reduce radiation dose. But I think you have to do this more on a vendor-specific base. So you should maybe work this out for every vendor. And I think that is what has to come up next.
In terms of the doctors, were they happy with the images that they got?
Yes, so I was actually one of the readers who had to review all the CT sets, and I think the overall image quality was quite good. So, and I couldn't tell a big difference between both groups.
That's
so
really important.
the image appearance was, in my opinion, comparable. So I was very happy about it.
That's really encouraging. And I know you've done other studies too. I mean, you did one where you were looking at patients with a low stable heart rate, diagnostic image quality could be maintained with a high-pitch helical scan first strategy, and that was 58% radiation dose could be saved. It's a different approach, but I found it interesting.
Yes, it's actually the Protection 4 study you're referring to. The Protection 4 study is a little different than the other protection studies because it was a single vendor study actually, because the concept of high-pitch helical scanning is only available for one CT vendor. So, but we wanted to test this concept with this study, and we could maintain diagnostic image quality as well in this study. But I think what is interesting is that iterative reconstruction goes with any other dose-saving strategy. So you can basically add this one on top of the others. So you can combine it to every other dose-saving strategy. And I think that is the strongest fact that we have about iterative image reconstruction.
Well, I think it's really promising, and I would love to have everyone take a look at the JACC imaging paper. It is in the August issue, and please look around for other coverage from the ESC meeting. For CardioSource World News, I'm Executive Editor Rick McGuire.